A quick recap on Hashimoto thyroiditis. So Hashimoto, it's a component of autoimmune hypothyroidism. All the components, all the clinical features seen in hypothyroidism will be seen in these patients. Basically, hypothyroidism is referring to low amount of T3 and T4. And always remember, since it's an autoimmune, there is always a genetic cause. So the genetic cause is certain mutation in the CTLA4 and the HLA gene, which halts the T helper cells or the cytotoxic T cells response. Basically, our T cells is, our T cells is responsible for either the destruction of the cells, that is basically done by the CD8 cytotoxic T cells, and other than that, it will recruit the macrophages because of interferon gamma, and that macrophages would be responsible for destruction. So that all activity is done, and after that the halt process is actually directed by the CTLA4 gene and HLA gene. And if there is certain mutation in the CTLA or the HLA, then that will lead to Hashimoto. Not only Hashimoto, CTLA gene mutation and HLA gene mutation is also associated with diabetes mellitus and different other kinds of diseases. Okay, autoimmune diseases like rheumatoid arthritis also. Now let's come to the major components. So in Hashimoto, what is there going to happen is the destruction of the thyroid cells. The basically this butterfly shaped structure is going to be destructed. The follicular cells of the thyroid are going to be destructed, because of which the follicular cells cannot form the thyroid colloid. The colloid, when it's not formed, the colloid basically consists of all the thyroglobulin and the T3 and T4 components. So if there is no thyroglobulin T3 T4, that will of course lead to hypothyroidism because of the deficient action of thyroid. And there is something which is known as oxyphil cells and Hürthle cells, which is a component of the histology, which is more common to pathology, and that will all later on lead to destruction. So a more common picture, a more beautiful picture is seen over here. This is the normal thyroid, and that thyroid is being destructed because of the cytotoxic T cells, and that normal thyroid will be again injured because of the recruitment of the macrophages because of interferon gamma, that is done basically by the Th1 cells, the thyroid helper cells. And you might be thinking, what is about Th2? Th2 is also associated with something else. Okay, but we are major concerned about the macrophages related damage and the direct damage which is caused by the thyroid cells. And again, we have this plasma cells which they recruit the anti-thyroid antibodies, and that will lead to antibody dependent cell mediated cytotoxicity. So, and when we come to morphology, oxyphil cells and Hürthle cells should not be missed. Remember, from I think you have you remember you have that idea from your hematology section, that whenever there was a damage caused by any kind of this lymphocytes, macrophages, there would be a presence of germinal center, and that germinal center is also seen in the case of this one, because it is all because of the inflammatory infiltrates. Okay, and remember how the thyroid is seen. How does the thyroid look like? Since it's the destruction, the thyroid follicular cells is destroyed in this way. Okay, but what happens is there is low amount of T3 and T4 in your body, because the thyroid follicular cells can't form T3 and T4, and because of which there will be increased amount of thyroid stimulating hormone, TSH. Okay, this is basically because of the negative feedback component, and this TSH will continuously it will trigger the thyroid cells to make more and more T3 and T4, but the thyroid cells are already destroyed. How could they make T3 and T4? That is why this action of more stimulating the thyroid will make the thyroid enlarged, but that enlargement is symmetrical. Okay, that enlargement is symmetrically enlarged. Remember, asymmetrical enlargement is seen in the multinodular goiter. That was a differential component. That's all from Hashimoto. If you have any questions, just let me know. There is something which is known as a fibrosing variant, but this is not that common. Like if someone's having extensive fibrosis along with Hashimoto, sorry, along with the destruction of the thyroid, then that is known as fibrosing variant. uh, okay, let me just discuss about this beautiful picture, beautiful histology scene. You can see these are normal thyroid component. Okay, these are normal thyroid component, thyroid colloid. Over here now you can see here certain oxyphil cells, and this whole thyroid are being destroyed. See, it is destructive thyroid component. There's something, there's German centers, presence of German center, and look at this cells which is highly eosinophilic. The marker, it tends to, okay, so you can see here highly eosinophilic cells. Okay, highly eosinophilic cells, let me just decrease. Okay, you can see here highly eosinophilic cells. So these are highly eosinophilic cells which are known as Hurther cells. Okay, that's it from Hashimoto. If you have any questions, please feel free to comment.